Playtime at Sunshine Daycare was always cheerful until Rachel Thompson joined the staff. Not because she brought problems, but because during medical crises, she responded like someone trained for far worse situations. And her fellow teachers were about to learn exactly what those situations were. Welcome to Hidden Legends. Before we dive into this incredible story, tell us in the comments what city you're watching from today. And hit that subscribe and like button. Rachel Thompson, at 32, was the most beloved teacher at Sunshine Daycare. She had been working there for 3 years and could light up that special spark in every child's eyes. She would patiently calm tantrums and enchant children with creative activities. Other teachers admired Rachel. Always calm, always prepared, always solution-focused. She was one of those rare teachers who could comfort children when they cried and make them feel safe when they were scared. "Rachel has magic hands," said Principal Mrs. Peterson. "After she touches them, everything gets better for the children." But Rachel's hands were truly magical, not just for comforting children, but trained for much more critical situations. Nobody knew this. Rachel's colleagues were Jennifer Hayes and Michael Park. Jennifer was a 28-year-old young teacher with a master's degree in child development. Michael was a 35-year-old experienced male teacher who had been working at Sunshine for 6 years. But Rachel was different from them. Her approach to minor injuries was much more professional. While other teachers provided basic first aid and called parents for every scratch, Rachel could assess wounds with medical precision. "Why do you look so closely?" they would ask. "Habit," Rachel would say quietly. But this habit came from very different places. Rachel's medical supply control was different from others. She knew the function of every tool, followed sterilization protocols, and constantly reviewed emergency procedures, as if she was working in a health center. Parents trusted Rachel. "My child is safe with teacher Rachel," they would say. They didn't know how right they were. That Tuesday morning had started routinely. Rachel, Jennifer, and Michael were doing routine activities with the children: painting, story reading, playtime, standard daycare program. But what happened at 10:15 a.m. wasn't normal at all. Rachel Thompson had joined the Army at 19. But why? It wasn't family tradition, it wasn't economic necessity. It was something else. And that reason put Rachel on a very special path. She had started with the medical corps, but after basic medicine, she was selected to go further. Combat medic training, the most elite program. But this was just the beginning. The real specialized training hadn't come yet. Advanced combat medical training, surgical intervention under fire, life-saving operations in field conditions. Rachel was selected for the top 5%, and that training would be very useful at the daycare. Her first deployment was Afghanistan. Medical unit at a forward operating base, treating wounded soldiers, performing vital interventions before helicopter transport. Advanced medical procedures in combat zones. That experience had changed Rachel. Her second deployment was Iraq, this time with special forces, medical support on the most dangerous missions, bullet wounds, bomb injuries, complex trauma cases. And the techniques she learned on those missions weren't things ever used in civilian hospitals. Rachel had learned to work silently. No extra equipment, limited resources, maximum efficiency. Her hands had become instruments, and those hands would attract a lot of attention at Sunshine Daycare. Her third deployment was near the Syria border. Black operations medical support, combat surgery under fire. Rachel was now competent at field surgeon level. But why had she left her military career to become a daycare teacher? This story was more complex. PTSD, adjustment issues, civilian life challenges. Rachel's transition hadn't been easy. But working with children was healing her. Their innocence was mending the wounds in Rachel's soul. After receiving an honorable discharge in 2019, Rachel had transitioned to civilian life. She'd used PTSD therapy, adjustment counseling, and career transition support. Child education had been a perfect fit. She'd completed her child development degree, obtained early childhood education certification. But her real motivation was different. She had protected soldiers in war. Now she wanted to protect children. When Sunshine Daycare hired Rachel, She was overqualified. University degree, military experience, advanced certifications. But the hiring committee didn't ask detailed questions. They were just happy to find a qualified candidate. Daily work was very simple compared to combat medicine. But Rachel noticed things others missed. A child with unusual breathing patterns, possible asthma development, a child complaining of headaches, potential vision problems. Rachel's assessments were thorough, her referrals appropriate, her follow-up excellent, but she never gave details about her background. "I've always loved helping children," she'd say. Simple answer, no details. At 10:15 a.m., what happened at Sunshine Daycare would expose Rachel's 3-year secret. During playtime, 4-year-old Emma suddenly collapsed and began having difficulty breathing. Rachel was reading stories with other children at that moment. As soon as she saw Emma fall, her entire body went on alert. This was the reflex not just of a daycare teacher, but of someone trained in life-and-death situations. She dropped the book and ran to Emma. There was chaos in the lobby. Children were scared. Other teachers were panicking. Emma was lying motionless on the floor. "Emma, Emma, can you hear me?" Jennifer was shouting in panic. "We need to call 911. Michael was reaching for the phone. Rachel quietly approached. She observed the panicking teachers, then focused on Emma. Pulse check, respiratory assessment, consciousness level. Everything came automatically. Emma's voice was weak, but she was conscious. "I can't breathe. My throat is itchy." Rachel immediately understood the situation. Anaphylactic shock, a serious allergic reaction. Emma's lips were beginning to swell. She was having difficulty breathing. "Jennifer, Michael." Rachel's voice was different now, authoritative, commanding. "Emma is having an allergic reaction. We need to find the EpiPen." Normal daycare teachers couldn't make such diagnoses. This was advanced medical training. "Rachel, how do you—" "Now's not the time to talk." Rachel's voice came from the battlefield. "Emma's airway is closing. We have 5 to 10 minutes. Rachel checked if there was EpiPen information in Emma's file. There was. It should be in the emergency bag. "Michael, get the emergency bag. Jennifer, keep the other children calm." Rachel put Emma in the lateral safety position to keep the airway open to facilitate breathing. This wasn't standard first aid. This was advanced life support. "Emma, stay calm. I'm helping you. Try to breathe." Emma's breathing was getting increasingly difficult. Her lips were beginning to turn blue. Time was running out. Michael came with the EpiPen. "Rachel, how do you use this?" "I'll do it." Rachel took the EpiPen. Auto-injector use, part of military medical training. She placed it on Emma's thigh, pressed the button. The medication entered her body. Epinephrine would reverse the allergic reaction. After the EpiPen, Emma's condition began to improve. Her breathing became easier. Her color returned to normal. But Rachel had hesitated. Something didn't feel right to her. "How do you feel, Emma?" Rachel was checking vital signs. "Better, but I'm still tired." "That's normal. The ambulance is on the way. We'll go to the hospital for a checkup." Jennifer had breathed a sigh of relief, but Rachel was still closely monitoring Emma. 10 minutes later, what was feared happened. Emma suddenly began to deteriorate again. She was having trouble breathing. Her color was pale. "Rachel, Emma's bad again!" Jennifer screamed in panic. Rachel immediately assessed the situation. Biphasic anaphylaxis. The second wave is starting. Jennifer and Michael didn't understand what was happening. Normal daycare teachers wouldn't know these terms. "What does second wave mean?" Michael asked. "The second phase of anaphylactic shock. The first EpiPen is losing its effect. Emma's condition is becoming critical." Emma's lips were beginning to turn blue again. Respiratory distress was increasing. There was no pulse oximetry, but Rachel's experienced eyes could see hypoxia. "Michael, is there a backup EpiPen?" Rachel asked. "I don't know. How do we find it?" Too late. Emma's airway could close completely. Military medical protocols had kicked in Rachel's mind. Field conditions, limited equipment, life-saving intervention. Emma's breathing sounds were getting increasingly difficult. Stridor, upper airway obstruction. If laryngeal edema became complete, Emma could suffocate. "Rachel, what are we going to do?" Jennifer was in despair. What Rachel pulled from her bag would surprise everyone. A small medical device, laryngoscope, something that shouldn't be in a daycare teacher's bag. "Rachel, what's that?" Michael's eyes widened. Airway control device. Where did you get that? No time to talk. Emma's oxygen saturation is dropping. Rachel put Emma in the supine position. She slightly extended her head, lifted her chin. She was preparing for bag mask ventilation. What is this procedure? Jennifer asked. Emergency airway management. I'm going to keep Emma's airway open. Such a procedure would never be seen in a normal daycare environment. This was advanced life support technique. Pediatric advanced life support. Rachel's hands worked with precise but determined movements. She placed the laryngoscope blade in Emma's mouth, lifted her tongue, made the vocal cords visible. How can you do this? Michael was breathless. Experience, Rachel briefly replied, but this experience came from battlefields, a small endotracheal tube, pediatric size. Why did Rachel have such things in her bag, and how could she use them so professionally? The tube was placed. Rachel started bag mask ventilation. Emma's chest rise returned to normal. Oxygen delivery was ensured. This is incredible, Jennifer whispered. Emma's color began to improve. The critical airway crisis was overcome. At that moment, ambulance sirens were heard. Paramedics were coming, but Rachel's intervention had saved Emma's life. When the paramedics arrived, the scene they found was surprising. A 4-year-old child, professionally intubated, vital signs stable. Ma'am, who performed this intervention? The lead paramedic asked. I did, Rachel quietly replied. The paramedic examined the equipment Rachel had used. This is advanced pediatric airway management. Are you a pediatric emergency medicine specialist? Rachel hesitated. For 3 years, she had been avoiding this moment. I'm a daycare teacher. Ma'am, normal daycare teachers don't perform laryngoscopy. They don't do endotracheal intubation. This is advanced life support. Jennifer and Michael were frozen. Who was their colleague, really? Who are you? The paramedic continued. Rachel took a deep breath. Former combat medic, 5 years in the army, Afghanistan, Iraq, Syria. Silence. Nobody was speaking. Combat medic, Jennifer repeated in astonishment. Medical intervention specialist in combat zones, surgery under fire, pediatric trauma, advanced airway management. The paramedic nodded. That explains it. Your intervention was textbook perfect. You saved this child's life. Emma was in stable condition when taken to the ambulance. Rachel's critical thinking and advanced medical skills had brought her back from the brink of death twice. After the ambulance left, Jennifer and Michael cornered Rachel. Rachel, you must tell us the truth. Who are you? How did you perform laryngoscopy? Where did you learn endotracheal intubation? Why do you have such equipment in your bag? Rachel remained silent for a long time. Then she took a deep breath. I'm a combat medic, 5 years in the Army, forward surgical team member, pediatric trauma specialist. Michael stared with his mouth open. You treated children in wars? Soldiers, civilians, children. Age didn't matter. Wounded came in, we treated them. Advanced airway management? Intubation under fire was standard procedure, limited resources, maximum efficiency. Now everything made sense. Rachel's calmness, medical knowledge, leadership in crisis, equipment repertoire, none of this came from daycare teacher training. So why didn't you ever tell us? Jennifer asked. Rachel's answer was simple. It wasn't necessary, until Emma's life was in danger. From that day forward, everything changed at Sunshine Daycare. Rachel was still doing the same job, but now her colleagues looked at her with different eyes. Our teacher is a war hero, parents began saying. Rachel wasn't bothered by this. She just continued doing her work, but now questions started coming. What was it like in war? How dangerous was it? Why did you become a teacher? Rachel gave short answers to these questions. Hard. Sometimes. I love children. But one day, 5-year-old Tommy asked her a very different question. Teacher Rachel, are you a hero? Rachel paused. Nobody had ever asked her this question. No, Tommy. I just did my job. But you healed soldiers, didn't you? This question made Rachel think. For years, she had just thought, I did my job. But she really had done dangerous missions to save human lives. Emma's story quickly spread among parents. The local news channel came wanting to do an interview. Rachel didn't want to give an interview, but Sunshine Daycare staff spoke. "Rachel's our hero," Principal Mrs. Peterson told the camera. "She's been working with us for 3 years, but we didn't know how special she was. If her intervention for that allergic reaction hadn't happened, we could have lost Emma," Emma's mother added. Rachel didn't want fame. She just wanted to continue quietly doing her job, but it was too late now. Veterans organizations started calling her. "Share your story. Inspire other veterans." "Not necessary," Rachel would say. "I'm just a teacher." But the veterans understood her. Most had experienced similar things, living quietly in civilian life, hiding their past. The local school district asked Rachel to come speak with teachers. At first, she refused, but the superintendent insisted. "Our teachers need to meet real heroes like you." "I'm not a hero," Rachel replied. "You may think so, but to us you are." Finally, Rachel agreed, but only once, only for half an hour. 50 teachers attended that seminar. When Rachel began telling about military medical experience, the hall was silent. "Working in combat zones is different," Rachel said. "Resources limited, stress high, life and death decisions in seconds. But every patient matters. Every intervention is critical." A teacher asked, "How can you stay so calm?" Rachel thought. Training, experience, and always focusing on what's important, the patient's recovery. Another teacher, "What was your most difficult moment?" In Afghanistan, after a bomb attack, 8 wounded soldiers came at the same time. 4-hour operation, we saved them all. The hall became even quieter. "So how did you succeed?" "Teamwork, focus, and never giving up." After that presentation, Rachel received dozens of invitations, but she still gave the same answer. "I'm just a teacher." But one day, a young veteran teacher found Rachel, an Iraq veteran struggling with PTSD, having difficulty working with children. "How did you adapt to civilian life?" she asked. Rachel thought for a long time. "It wasn't easy, but you need to find your purpose. I used to heal soldiers. Now I protect children." Working with children? Not just working with children, providing them with a safe space, giving love, helping them build their futures. Service never ends, it just changes form. That young veteran now works at another daycare. She started with Rachel's advice. Today, Rachel Thompson still works at Sunshine Daycare, but she's no longer just a teacher. She has also become an unofficial medical consultant. The daycare director asked her, "Rachel, would you give basic medical training to our other staff?" Rachel agreed. She taught staff CPR, basic first aid, allergic reaction intervention. Her training was professional, comprehensive. "You're really a medical expert," the director said. "Used to be," Rachel replied. In Rachel's room is a carefully placed photograph, her military medical team in a combat zone. Young Rachel with her friends beside the medical tent. Visitors looking at that photograph ask, "Do you still see your friends?" Some of them. Some are retired. Some didn't make it back. These last words are heavy. Because war is dangerous. Some operations remain secret. Some losses are never forgotten. Do you think about them? Every day, and every time I help a child, I honor them. Emma is now 7 years old, healthy and happy. She still comes to see Rachel. "Teacher Rachel, you saved my life." "Emma, you're a very strong child. I just helped." "When I grow up, I want to be a doctor." Rachel smiles. "That's wonderful, Emma, but finish school first. I want to be like you." You just need to be Emma, but don't forget to help others. That's how hidden legends do it. They don't hide their past, they just carry it quietly. Rachel Thompson didn't talk about war service because it wasn't necessary, but when needed, those skills were still there. Sunshine Daycare parents now look at Rachel differently. They see her not just as a teacher, but as a protector. And Rachel has accepted this. "People see you as a hero," Mrs. Peterson said one day. "I just do my job," Rachel replied. "That's exactly why you're a hero." When maternal instinct and military training combine, they form a powerful protective shield. Rachel Thompson protects children with love while also keeping them safe with her vital skills. So have you ever encountered someone like Rachel? People who appear modest but have extraordinary backgrounds. Heroes who serve quietly, don't boast, and only emerge when needed. Your children's teachers, caregivers, guidance counselors, who knows which one has a secret past? Share their names in the comments. Because here at Hidden Legends, we know that the greatest protectors often serve in the most loving roles. If this story moved you, like, subscribe, and help keep these voices alive. We'll see you in the next legend. And until then, remember, your child's teacher might be the one with the skills to protect their life in the toughest moments. Real heroes always live among us, hidden in strength disguised by love.